just prisons since the pandemic hit the country. Interior Minister Fred Matiangi says that 7,000 prisoners are being set free. Now, if you go to Botswana as well, easing down of their lockdown protocol. So some people have begun a gradual return to work, not on a mass scale, but at least some level of work is being allowed. And Tanzania, our good friends in Tanzania, Vivian, they have even eased restrictions on international flights. At the moment. So that for those of you who want to visit Tanzania, now is the time you can enter. But
that's if we open ours.
Yes, if you can pass through ours, you can go to Tanzania. And then also interesting that Tunisia, which is one of the hard hit countries, if you look at the North African numbers, they have recorded no new case of COVID-19 for the first time since early March. And the government has announced it will further relax restrictions on movement and businesses. Now, they have reported 1,032 cases, but 45 deaths. So they had a really high death rate as compared to that. Now, 745 patients have recovered, and only 11 are in hospital. Now, shopping malls, clothing stores, and hairdressers have been asked to reopen from the 24th of May. So that is what is happening there. Let me move from Africa then to the rest of the world to give you an update. I would have added Ghana, but we all know what is happening in Ghana already. Okay, so let's go global now. And the United Kingdom, as we all know, has unveiled a 3-step coronavirus recovery plan. Those who listened to the Prime Minister's address yesterday would know what I am talking about. So in each step, there are 3 phases quickly. Beginning Wednesday, people will be allowed to leave the house for outdoor recreation and leisure with members of their household, and individuals can meet with one other person outside their household. Now, they can also drive to outdoor open spaces irrespective of distance. That is the phase 1. Then beginning phase 2 is June 1. That will start on June 1. For them to follow social distancing guide. One that is coming from a lot of sad news to report from Spain. Well, Spain has recorded its lowest coronavirus death numbers in more than 7 weeks, and that is 123. So in Spain, they are taking this as very, very good news. When you move from the thousands to 123
doing well.
over a 24-hour period, they can consider it good news. And at 0.7%, that's the lowest daily mortality increase in 7 weeks. And that brings their total number of deaths, Vivian, to 26,744. Now, Spain's Director of Health Emergencies, Dr. Fernando Simon, says that authorities are closely watching new data from some Spanish hospitals reporting somewhat younger COVID-19 patients. So that seems to be the problem now, that they're having a surge in parts of the country which is affecting only young people. One. And also, France is beginning to lift some coronavirus restrictions. So it looks like all the major countries, France, Italy, Germany, Spain, UK, the big ones in Europe, everybody is beginning to show some level of movement. Now, France is doing this very slowly. They are opening today after almost 2 months of strict lockdown. So from today, most shops are allowed to reopen as planned. And some areas will still face stricter measures than others, with the country split into 2. Now, they are splitting them into red and green zones. So if we're in Ghana, Accra, at the moment it's a red zone. Savannah region, green zone, because there's nothing there. With the lockdown measures stricter in the red areas. Now, schools will be allowed to begin on Monday, but classes have been limited to only 15 students. Per class. So that is the situation coming from France. I want to give you a vaccine-related story at the moment, but
any good news?
Yeah, not yet. But from the US, well, nearly 80,000 people have died from the coronavirus. The exact number is 79,520. 79,528. Now, follow closely Russia. Russia, that a month ago, was doing so well, did not have any cases. They now have the 3rd highest number of confirmed cases globally. Now, on Monday, which is today, they recorded 11,656 new cases of coronavirus. bringing their total case count to 221,344. So they are ranked behind the US and Spain. Now, the worst hit is Moscow, of course, the capital, where they have 115,000.
So all these are through testing, or these are...
Yes. Now, the Russian capital saw its mortality rate surge last month with 11,846 death certificates registered. Now, around 20% higher than a 10-year April average of 9,866. Now, some critics and experts have said that the country's relatively growth rate understates the true coronavirus death toll in Russia. So there are those who believe that Russia is behaving a bit like China when it comes to their numbers. It's not one of those countries where you can go and say, hey, your numbers are, where are the numbers? Show me the numbers.
Not sure.
They are telling you their numbers. It's either you take it or you leave it. So that is the situation there. I think Salom has Africa.
Yes, so let me just quickly rush through some Africa figures. So South Africa, as Godfrey rightly said, tops the African chart with 10,652 cases. They've recorded 206 deaths, and 4,357 of those people have recovered. Egypt follows with 9,400 cases, 525 deaths, and then 2,075 people have recovered. They've tested 90,000 times, and this 90,000 has been there since the last week. So I'm sure their testing numbers are not being reported, or they are not reported in real time, perhaps. So Morocco follows with 6,226 cases, 188 deaths, and then 2,759 people recovering. Algeria follows. Ghana comes in with 4,700 cases, 22 deaths, 494 recoveries, and we have tested 160,501 times. Now, so there's a shift in the log. So Ghana and Nigeria have moved a few spaces up. So Nigeria then comes after Ghana at number 6 with 4,399 cases, 143 deaths, and then 778 recoveries. Nigeria has tested just 23,835 times. So Cameroon follows, Guinea and Senegal. But the Ghana-Nigeria figure is quite interesting. Ghana has 4,700 cases cumulatively. Nigeria has 4,399. But the interesting thing is, when you look at it, you realize that Ghana has fewer deaths than Nigeria. That can be explained. When you look at the total number of recoveries, Nigeria has 778 people recovering from the disease or the ailment, whilst Ghana has just 494. Ghana's figure has been at about 10% for a while, 4,700 cumulative, and then 494. That's just about 10 or 11% of the total. The point is that Nigeria is not aggressively testing as Ghana is doing. Ghana is tested 160,000 times. Yeah. What this means is that Ghana is trying to chase the virus or going after the virus in our enhanced testing, a system or style of doing things. What this means is that we are picking people who are not even showing symptoms. What Nigeria is doing is they are mainly, relying on the routine surveillance, people who present with the conditions. Of course, there's some other testing going on, but this is their main mode of recording cases. So what happens is that when you wait till the people, present themselves at the hospital because they are manifesting symptoms, it means that they are at a more dire place or dangerous place, if you like, than those you would pick ordinarily from the public, like what Ghana is doing. Yeah. So with this, Ghana's, so it is not surprising that their death rate is higher than Ghana's, because the people actually fall sick or start showing symptoms before they go to the hospital or they go to the testing centers. We are not doing that. So our death figures low. That is to be expected, and that's good. But the issue for me is the death, the recovery. So if we are picking cases earlier, which means that they've not reached certain critical points, I think our recovery rates should be higher. Nigeria's recovery rate is higher, that is 778, whilst ours is 494. Many things have been said. It could also be that it's because of our protocols for passing somebody as recovered.
But in Nigeria, do we know their protocol? We don't actually know. But if you recall, at one of the ministers' press conferences, was it the Director General of the Ghana Health Service or so, said that, given how things are progressing, Ghana may soon start adopting the single negative test thing. So that if you test single negative, you could be passed.
But
now,
that's safe, especially when we had the case where the imported cases, they tested,
the first time, yes.
And then we've had other cases where it's safe to do them,
yes,
put them back in the system.
So my thinking or the discussion really has been that it could be that Ghana's way of passing people as recovered is quite stringent, and which is good. And I think we need to look at what it is and possibly get a WHO or somebody to standardize that process so that when somebody is passed as recovered, we know the person indeed has recovered. And I also recall weeks back when about 30 people or so were discharged to go home but continue treatment from home. That was reported by many media houses as recoveries. And I don't know if it's a similar situation where people are discharged from hospital, so that is recorded as discovery. Maybe our system is a bit stranger, which is good, so that when you are passed as recovered, then indeed you have recovered. An interesting thing happening in Tunisia as well. Tunisia has not recorded any case since for a few days now. So for the first time since March 2020, they said this morning or today that the government that they will relax restrictions because they've not tested any positive case in the last few days, and I think that's quite some good news for them, and it only means that they are coming to an end of the curve. That is, if nothing happens to cause the figures to spike.
Okay, so interesting developments around Africa. Let's come to our own country, Ghana. We're at 4,700 cases, recoveries 494. And of course, the deaths haven't been so,
Yes, 22.
Yeah. So let's start with that.
Okay. So looking at the numbers as they appear on the Ghana Health Service website, I must also admit that there's been a change, or there's been an addition to the table when you look at it, because people have been asking for a lot more data. So for instance, if you go to table 2, you will see now they are showing us total number of tests. They are showing us total persons tested, and then total positive.
Because
then,
those issues were something that we've had back and forth.
So they must be commended for listening and slowly, expanding the data sets that we have, which is all we've been asking for. That in doing this is not a situation where you can say, oh, I'm reserving the information for myself. Put it out there and let the whole country help you so that we can do the education properly. So it's interesting that, for instance, under general surveillance, for instance, recovered and discharged 494 cases. Those who are doing well and responding to treatment in facilities are at 891. The critically or moderately ill is at 5. Like you said, the dead stands at 22. Total is 1,412. For those in mandatory quarantine, recovered and discharged is at 0. Well and responding to treatment in facilities will be 115. And Salam has raised questions about this severally as to why this number has remained the same for a very long time. Does that mean they are not recovering at all? And then under enhanced contact tracing, which is where we have the most of our cases, 3,173 are well responding to treatment in home facilities. None of them are critically or moderately ill, and then the total number is at 3,173, cumulatively making the 4,700. Now on the tests, on the new data sets that have been added, it's interesting. Under routine surveillance, they have done 40,807 tests. 40,807 tests, which equates to 40,807 tests. To 40,807 people. So one test for one person. It's not different.
It's not you recovered the recovered routes where I'm testing you 3 times. You went to it.
So there's a different data. They put that in the different systems.
In the different systems.
Yes, and then the total positive is at 1,412. That is for routine surveillance. Now contact tracing, 117,672 have total number of tests done, same number of persons because 1 is to 1, so 117,672. Total positive rate of positivity rate of 2.7 as they measure it, with a total positive count at 3,173. For the mandatory quarantine, again, the numbers have not changed. It is what it is, and that gives us a total number of tests currently at 160,501. So we have done, as at yesterday, we had done 160,501.
Just a quick one for you guys. When last week we recorded over 1,000, have we done contact tracing with those 1,000 people?
Those are numbers that will come to if you want us to enter the details, because some of the numbers were a bit, but on the original count, for instance, Eastern region is at 99 now, it's gone up. Central region has also gone up. Central region is at 127. It's almost a doubling. If you look at Central region's numbers, the Central region is at 355, and Greater Accra is at 3,892. So those are the numbers for the Greater Accra region. So if we are looking at the 4 big places, you are looking at the Greater Accra region, you are looking at the Ashanti, you are looking at the Central, and you are looking at the Eastern region. Yeah, so Vivian, that is the situation with Ghana. And I guess we got a couple of other details. The cases came from a factory and all those things.
So 500 from a factory in Tema. We're told a processing factory in Tema.
And I have quite some issues with
we have a lot of questions.
You know, because in this era of...
And then they were infected by one person.
Yes, in this era of social distancing, observing protocols, etc., I'm wondering why
the
such
factory was still running.
Huge number of people will be operating from one facility, and whether or not there were some precautions or there were some measures put in place to avoid the spread of a virus like that. 1,300 people working from one facility. I don't know how huge a facility is. I don't know how it's been structured, but 1,300 people working at a single facility like that. I thought in these times it shouldn't have happened.
But actually, we are seeing, not to cut you, I'll let you go. Actually, we are seeing that with a lot of factories, even some of those producing the PPEs.
So the PPEs, yes, I could understand to some extent that maybe they are producing some essential materials or equipment necessary for the fight. So given the critical nature of their job, I'm expecting that, of course, when was it Mario Sanda who went there to speak to them, they told us that after every 30 minutes or 1 hour, they are made to wash their hands and apply sanitizer. I hope that is true. I hope they're not just speaking to the camera, so they said those things. Because of the nature of the job they do, a lot more eyes are on them compared to some factory or some industrial facility somewhere in Tema or somewhere that had 1,300 people. And just one person, don't know when that one person got infected before infecting the rest of the people. But it is, I think the system relaxed or took its eye off things like that. And by this, by extension also, it means that there could be a lot more industrial facilities like that operating. I think it's about time the authorities got to those people and got them to either cut down on their number or put in place stringent social protection.
But I thought there were rules around
social
still running
the protocols, so that we don't have
these
this.
cases.
And what this means is that it is a danger to the people in the whole of Tema. Because if 533 or so people, or how many were there? 500, about 500 people from one facility. And this, I don't know when the samples were taken, but from the record, the samples are taken quite a few days before the results come.
And there's also a problem there, just to focus, with when the samples were taken and when they were processed. Now, as at Thursday, we're not supposed to have a backlog.
Yes. As at Thursday,
which is something we need to look at. This backlog
then and Sunday, we roughly ran through 14,064 tests. And when did we trace that? When did we trace this one person who's responsible for all this in a day? I think there are lots of questions. We need clarity on the Tema situation.
We are told that because of the polling system they run, they're able to test about 1,000 people or get results for about 1,000 samples in a day. Critical question Godfred raises that are they saying that they've started or they've done contact tracing for that single person? Now I don't know a single person, because a lot of people, it puts the people in Tema in quite some difficulty, because these are people who are community, they are factory workers, they are ordinary people, they bought trotros, they move about just like anybody. And I don't know when the samples were taken, I don't know when the results really came out. We got it when 3 days ago or 2 days ago. These people have been in the communities. And they've been moving from place to place, because a lot of them are not exhibiting or manifesting symptoms yet. They have been moving from place to place,
presumably infecting people. For me, that is the biggest danger in this. And if the authorities are listening, if there are other facilities like this operating at other places, I think it's important that they either shut them down or they get them to adhere to strict protocols. I'm wondering how big a facility will be to accommodate 1,000 people. I don't know if they run shifts. I don't know how they operate. But having 1,003 people work from the same facility in these times, I think it's quite reckless.
And it's also be interesting that post that happening between Friday, Saturday, and Sunday when we got the numbers. For instance, in that municipality, does that mean that we are checking all the factories?
Yeah.
All of a sudden, because the fact that you've caught one
doesn't mean
that they're the only ones.
Yeah.
There could be others.
Yeah.
So what has been the protocol? And that's what I'm saying, that we need a bit more information on what happened with that particular factory situation, because I struggle to come to terms with, we have all the 533 persons coming from here. It sounds a bit incredulous to me.
It's a big thing
to
because,
my thinking,
like someone was saying, 500 people, the number of people they've come into contact with, their families, friends, because we're going about life like normal.
I want to find out tomorrow. Was it, there are certain industrial complexes that operate like school dormitories.
They don't go
So
home.
they don't go home.
Let's
so they
hope
sleep.
so.
We had one in the Eastern region, like AFCONs, which was also a significant area for the Eastern region outbreak.
But I see the AFCON one is, they were there for a specific purpose. They are working on the railway.
The railway,
So that's like...
no, I'm just saying, I don't know whether this facility has like dormitories.
It's a fish... It's
so
a
maybe you
fish
finish and then you go and sleep.
And it's in Tema industrial area or some Tema.
I don't know, but all I'm saying is that's why we need a lot of information regarding this.
And if you recall, in the AFCON case, we were told that the night before the samples were taken also, a few of them went out to some other places. Are we sure that even if these guys are camped at one place, they do not, because they are not in prison. The fact that you are camped somewhere doesn't mean you cannot go out. So, I mean, even if they are camped, which for me doesn't look the case, but I'm just giving a benefit of the doubt. Even if they were camped, how sure are we that they've not gone to town to contaminate the general population out there? These are critical questions we need to answer. And if it means doing something drastic in the Tema area to contain this, I think we need to do it quickly, because I mean, Tema and Accra is already, the epicenter. We need to really do something drastic to get all these numbers. And I don't know how many of their contacts they've traced yet. I don't know when they began the contact tracing. I don't know what numbers they have yet. And we don't have a lot of information. And it's so critical that something drastic is done.
And again, it's a few things don't tell. If you check the bullet points that were put out on the president's statement, some of these tests were as a result of a backlog from April 26th or 27th. And that's what I'm saying, the information sometimes doesn't
is this
tally.
backlog for some? Is this still KCCR?
As at KCCR Thursday, we were, as at the 6th of May, we were told that KCCR had 1,982 as backlog.
And
which
then
did not have any.
cleared everything,
So between Wednesday, Thursday, Friday, what happened? It was that when this case was picked up, sent back, it became a backlog when there's a lot of information we need. And the authorities should forgive us. But it's important that we push for this kind of information, because you see, once you give us answers that satisfy the general populace, that is when there is confidence. And also you have people even coming out to help with what you are doing in terms of the contact tracing. Because for the Tema 1, whether you like it or not, we've looked at cases where, for instance, for just 70 people, you are tracing sometimes 3,000 people. So imagine the number of contacts you have to trace for 533. Then beside that, you also have, for me, Vivian, another significant number that we have ignored. The 300 plus persons in the general surveillance database between, again, that Thursday and Sunday, coming from the Greater Accra region. It tells us that there is something significantly wrong with the way we are handling this, because it looks like the disease is thriving. The only positive we have going for us at the moment is the low mortality rate. That is the single positive we have going for us. I am with Solomon when he says that, for instance, in the Tema area, there should be a significant level of not just enhanced contact tracing, but but a significant level of random testing. And we've seen the Ghana Lab Association ask for that on a national level. But I think perhaps it might make sense to start with Chema, because if I'm not mistaken, this is the largest single super spread
after the AFCON thing
we have seen. And we are saying, so based on the information they have given us, that this all emanated from one person. You know, it would be interesting to know even how they figured that out. We can add that to the knowledge database that we are building out of this. But quite a few significant questions
tomorrow
to answer.
there's a presser. We hope some of these questions are addressed, you know. But then we say at the point we've reached our peak. So why does this for peak or spikes or what?
Forget about that talk. You know, I think...
you can reach your peak and then something happens and then you have the spikes,
we don't know yet whether something significant happened between the time we were told we had reached our peak and now. It could be true based on the data they had, but you don't immediately announce when you see when you appear to have reached a place which is the highest point and say that's your peak. You wait and see what the figures will look like in the next few days. And even that day, 25th of April or so, they say give us our peak. It is important to also find out what the sample size was. How many samples were tested to produce that peak number? If you tested 10,000 samples for that day, and we don't have the figures, and maybe you recorded 200, and that 200 positives give you the highest, which is the peak. Look, you have to look at it against the sample. If on previous occasions you were just testing 1,000 samples and we were giving you, let's say, 50 or 100, and on that day you tested 10,000 samples and they gave you 200, yes, it is the highest, but you must knock that off against the sample size. That will give you a false positive, a false figure, thinking that that's the highest. Meanwhile, it was not. I mean, the sample size were not generally the same. I mean, I don't know if you get what I mean. So we need to look at all that, and we don't have that data to make that determination right now. You know, so it's not looking pretty good. I've been looking at the figures over the period, and between the 1st of May and the 10th of May, you know, we have jumped from 2,169 to 4,700. That's in the space of about 10 days. And then from 22nd to, let's say, the 1st of May, 22nd April was 1,279. I should have had the figure before 22nd April. 1,279 to 1st May, which was 2,169. About 9 days or so, or even 8 days. Even with this limited data I have, it appears to me that after every 10 days, our figures seem to double. Though I don't have a lot of data to be able to concretely make that determination. But we need to understand what our doubling time for this virus is. But from the little we have, it is appearing that, especially as on the 12th of March, we had just 2 cases, and then somewhere around 22nd of April, we had 1,279 cases, and it keeps going. We need to have a clear understanding of what our doubling time is, and that will help us, you know, appreciate properly the measures put in place, and if there should be any revision moving forward, then we'll do that quickly before we get to a place where our systems will be overwhelmed.
Okay, some few questions, messages coming in. This one is from somebody who says they work at a particular factory at Tema. They say that, I'm not going to mention the company, but they say that between 18th and 20th of April, their samples were taken for testing. Now, these samples were taken after one of their workers tested positive. They say that work has resumed today with 1 shift, and yet workers don't know their status. This is the person says is worrying because the president announced that one person in a particular, you know, so they are worried about that. So this is the first one. This one from Faustina in Takwa, she says basic reproductive number, which is the R0, is the expected number of cases directly generated by one case in a population where all individuals are susceptible to infection. How can an advisor to the president confidently tell us we have reached our peak while GHS director admittedly said our R0 is more than 1.5?
Yeah, he said 1.9 to 2.5 or so, thereabout, he said.
So she's wondering why we have that. And then this one from Professor Joseph says, please, may we know why those tested from the mandatory quarantine are not recovering, or we are not seeing any changes in their situation?
That's an issue we have raised on many occasions, because those people are
Among
people,
the early birds.
Yes, and there are people who did not present. Which ones? I mean, the
travelers and the mandatory quarantine.
Yes, right. Yes, it's interesting. We've not seen much from that side too. I think they need to start telling us something, because when you look at the table, those cells remain very stagnant. It's just the routine surveillance side of things
taking
that we've seen a lot
yeah.
of the movements, the deaths, the recoveries, etc. We need to really understand what's happening with those mandatorily quarantined people and then the enhanced contact traced people. They've remained the same. We've not seen any movement, in terms of moving from the mild conditions they say they are in to let's say recoveries. We've not recorded mortalities for them as well. So it appears nothing is happening there.
Yeah.
We need to have some understanding into that and possibly some explanation, because a lot of them did not present with symptoms.
Okay.
And if those who had symptoms are recovering, how much more those whose situations were caught early, which by extension should mean ordinarily that they should be one of the first people to recover. I think we need we need experts to explain to us how it works out.
Okay, so we're doing all these things, our numbers are rising, we're a bit confused about some of the data coming in or all that, but what are we not getting right in the spread we're seeing, and especially with the huge numbers we're recording?
It's the same two things that we have been reiterating for the past month and a half: the enforcement and the education. And in the president's address yesterday, we heard him make mention of the fact that, well, the National Commission for Civic Education will get some PPEs and some money.
Yeah.
Vivian, that should have been day
long
one.
ago. Yeah.
That should have been day one.
Better late than never.
Yes, but that should have been day one. That is what they exist for.
And that's what they are trained for.
You see, they are in every region, albeit under very poor conditions. We've seen their offices. We've covered every single NCC office in Ghana at this station. We know how they operate. Okay, so that should have been day one. But like you're saying, it's coming in. When the lockdown was lifted, I made the point that the money that was being assigned to A, B, and C, if need be, should be added to the resources that were being made available for education, so that the Ghana Health Promotion Unit, Ministry of Information, the Information Services Department that also works under them, community leaders, so that we can have a very aggressive communications strategy, so that people understand that there's a need to stay home, there's a need to do this, there's a need to do that, so that we don't have the conflicting messages that we are getting. Because it got to a point, and that was reflected in the health minister's presser last week, where he sounded frustrated with the system. But as soon as he's done, somebody else comes to stand there and says, well, everything is fine.
Yeah.
See, it's something that needs to be fixed. We need to get on the same page. If the message we are seeing, and that is, for instance, I'll give you a typical example of what is happening now. In the UK, for instance, the Great Britain and its outlining territories at the moment, there's a significant conflict of messaging. Because Scotland's Nicola Sturgeon says, hey, Boris Johnson, the message you are preaching there, be very clear that you are speaking for only the people in your territory. It doesn't apply to mine. Wales says the same thing. Northern Ireland says, hey, Boris Johnson, speak for yourself over there. You say stay alert. We say stay at home.
Stay at home,
Don't let your message be stay alert for all of us. No, we have not come to that conclusion. So we need to get on the same page for our messaging. If there's a need to raise the urgency level, look, this is not a competition, Vivian. We are not awarding trophies for who does what at the end of it. The only trophy we need is that at the end of the day, more people don't die. So if we have reached a certain level where we did not expect it to be, and you need to show a sense of urgency in your messaging, there is no shame in putting out a message of urgency at this point. Go out there and say, my people, look, we have lifted the restrictions. You can go about your economic activities. But employers, be responsible. Employees, be responsible. The disease has not gone away. It's not the president saying it's one-off that will let people be responsible. The president has been speaking for 9 weeks now. People are doing what they are doing. If they were going to listen, they would have listened a long time ago. Okay, so it's time to get on board and say, look, this is the message we are putting out there. And then aggressively, and that is, I emphasize the word, aggressively sell that message to the various communities, especially Greater Accra. Because at the moment, we are the epicenter, 3,000 plus cases. So if they know where the hotspots are, looking at their own data, go to those communities, turn them upside down with your messaging, add your testing, and then let us see some proper progress on the ground.
So the inconsistency in the messaging, very, very bad. You must run with one message, especially in a serious situation like this. I think there are too many people who mount that minister's press conference stage to speak. It appears it's become a place that people want to come and show that they are working. We need to have just about 2 or 3 people who understand the situation and can give answers. So, for example, Opon Nkrumah is there, he may deal with the policy issues. The gentleman from Noguchi, the virologist, the head of the virology department, Professor Ampofo, anytime he comes to speak, we see the authority with which he speaks, we see how far his message goes. Why can't you make such a person a constant feature? I don't think it's the way to go when we call in a lot of other people, finance people, small scale people, all these people to come and talk on that COVID-19 platform. Ghana, as we speak right now, almost everything we are doing is geared towards COVID-19. So you don't need to be on that platform to speak for us to know that what you are doing is geared towards COVID-19. MDSSI, very, very important job they do. But the message they give may get lost on that platform because there are other things that are said. They could hold their own press conference at some place, of course, observing the protocols and give out their message. I don't think they needed to come to that place. It confuses the message, and the singleness of message that the media should go out there, should go from there outside, is not there because they now have a lot of things on their mind they have to report on. I think we must focus on using very few people who are experts, people who are not politicians, because once you use politicians to disseminate this information, there is now an impediment or a blockade. You need to be able to penetrate that. Let's use the experts. Professor Ampofo, for example, very solid guy. I don't know his political affiliation, but I don't care because he doesn't do a political job. He's an expert and properly so-called. These are the people that the president and the information minister have said we should listen to. Let's give these people the platform, make them the key speakers or the keynote speakers, if there is anything like that in this situation. Let them be the guys to talk.
But
let them be the guys to answer the question.
To the extent that we've chosen
and the so-called experts who are now politicians, they've not helped matters. They come and tell us this today. Tomorrow they say they didn't say that, and that the media misreported them. Meanwhile, we all heard
what they said. But if we've chosen Tuesdays and Thursdays to address everything COVID. And in this case, can so if there are issues still, because people with the stimulus thing, it was something that a lot of businesses were asking questions
but you didn't have to address that stimulus thing on that stage.
Well, if a lot of people were demanding answers over it, and you've chosen 2 days to address everything COVID, is it really out of place to deal with it?
You see, we've had instances where you could call a press conference and deal with the matter.
So you want it to be separated?
I want
Isn't that also waste of,
Waste of what?
I mean, going to deal with something
it's
when you could just add it to
the what I'm saying
picture.
Is that it confuses the message. There are too many things that are put out. So the real message is lost. And what's the real message? Observing the protocols. Very simple message. And it's very easy for it to be lost. Wear masks. Practice social distancing. Don't shake hands. Don't touch your face, etc. These are things you've heard many times. So, in actual fact, if you talk about something very newsy, they are not. And a journalist is always looking for something new and exciting. So, if you bring other people to come and talk about other things which are, moving us away from the track we really want to remain on, you are not doing yourself any good. We want the message to remain. Protect yourself, wear your mask, do this, do that, do that. This was what people did here. It didn't work, and we don't want to do that, so we are doing this. That is my view. Others may disagree, but I think that there are too many people mounting that stage to speak on COVID, which I think it distracts or it takes us from the main issue.
Is it time we start really sanctioning people for instead of, there's a rule around it, 12,000 and then 4 years in jail and all that. But it doesn't appear to be deterring people, For example, this wearing of masks thing, people do it when they feel like. When you ask them to say, oh, nothing will happen to me, I don't believe in this thing or anything. Really, we've not seen people who have really been punished that would deter people, because the preaching about your health appears not to be working for some section of the public.
Well, it's been a global issue, this particular one. I recall there was a week when Italy's numbers were at their highest. They fined people almost to the tune of, cumulatively, they made almost 400,000 euros in a single day on fines. And that was when Italy was recording 1,000 deaths a day. Yeah. People were still doing what they wanted to do. Okay, so it's a mixture of things. It's a mixture of getting the education right, so that people are responsible. On this, a certain level of personal responsibility must apply for people. But the situation for us also is that people think the disease is very far away. Under our circumstances, you see, and for me, I tend to look at this in a very individualistic nature. Under our circumstances, as soon as we report 533 cases in a day, I shiver a bit. But for a lot of people, it doesn't register like that.
Yeah.
Okay. And so I ask myself, why is it that 533 cases is not registering for those persons in that way that I feel, okay, this is a problem. Tema should be on the lookout.
Yeah.
Are the residents of Tema feeling that they need to be on the lookout? What has the TMA said about this? Has the TMA by itself ramped up its education based on what has happened over the past 2 days? Like I said, if today the TMA had taken it upon itself to start visiting factories, or the TDC starts checking factories today, would have heard. Yeah. Would we not have heard that they are checking factories? Have they visited any factories to check? Based on what happened at one factory, and in this day and age when common sense should tell you that you're not supposed to have this number of people working in a room, had over 1,000 people working, you should be doing spot checks by now. And the impact of that will reverberate on the community, because the community works in those factories. So once they start hearing that, hey, the people are entering the places where we earn our living and are closing us down or are enforcing that we do A, B, and C, they'll start behaving, because they know that, okay, this is serious. Okay, so far the livelihood equation has won, and rightly so, because that is the nature of man.
Economics before health.
Well, that is what it is. For a lot of people, it is basic survival. They are not even just thinking about the economy. They are thinking about what they'll eat now so that they don't die at 6.
Yeah.
Okay, so it's that kind of decision they have to make. But to reach those persons, you have to spread a different kind of message. The message that you are making for Godfred Akotobuaf on COVID is not the message that you make for Jahamensa, who lives elsewhere under very different circumstances. To let that person understand. And I feel we haven't been nuanced enough in how we have taught the message. I hear a lot of, when we are done with this, you can get on your WhatsApp, la 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 la. I've seen the mobile penetration numbers in this country. How many people do you think are going to check WhatsApp to see today's update on what to do when coronavirus comes to your neighborhood? How many? How many?
It's what it is.
You see, how many? So what the impact therein is what? So for me, the education part, I will not stop harping on. The enforcement part, the local assemblies, I will not stop harping on. We need to get those things right based on the current set of circumstances we have given ourselves, which is that we are not going to let the economy falter. So people will be allowed to go about their economic activity, which is fine. But once you make that crucial decision, you have to police people.
Yeah.
And by that, I don't mean the police service. But you have to police people.
Shalom.
You see, back to the Tema thing, my other frustration is that a lot of the about 500 people who we hear have been infected from the same facility, a lot of them are factory hands. I mean, they are the lower end people in the society. Look at the places they live. Very, nucleated settlements, one room, chamber and hall with the whole family, etc. The rate of spread amongst those people could be higher than instances where the person lives in a bigger place, many rooms and that kind of thing. And that is what we are joking with. And once it moves from the facility into the community proper, then we just have to I don't know what we have to do. That would be very, very dangerous. Like Godfrey said, I am expecting that by now, other assemblies are taking a cue from this. They should have a database, or they should have information on all places within their jurisdiction which operate with a lot of people. So like factories and those places. They must start visiting those places. They must do checks, like they must do unannounced checks. You go to the place per your estimation, and every assembly has a public health office. You go with that public health person. If they go to the place per their determination, you know, if the place is not safe, social distancing, everything, all the protocols cannot be adhered to. It's not for them to say they are doing it. Yeah. If per the estimation of the experts, the public health person following the assembly, the DC or whoever, they go there and they realize that this is not doable to save the whole country tomorrow. You know, they may cry today. It's better than they will cry forever tomorrow. If you cry today and you end tomorrow and continue with your life, it's better than you defer the cry for today to tomorrow where you will cry forever. I think that is, so the district chief executives and the assemblies, I don't think should necessarily wait for the president to give them such specific directives before they move. It is part of your job. Move around, visit places where a lot of people are. I didn't even know we had a place in this country in this time where 1,003 people will be working. What is that? And it even flouts the EI 64. You don't have to gather in huge numbers, but some people were given exemptions. For those exemptions, ensure that the protocols are in place and are adhered to. That is so important. So you see, you know, and one thing I've noticed is that when this whole thing started, you go to any place, it was fashionable to see the Veronica buckets and tissue papers and all those around. Now the things are there, but nobody uses them. Nobody's even using them. Nobody even allows you to wash your hands anymore.
It's become sort of like a verification tool. So I have it.
And we need to get back to that. You know, the president could say could do a lot of things, but it now depends on us to take this fight on and win it. All the president can do is say, okay, I've done this, I've done this. But it depends on us to observe the protocol. The president cannot come to your house to ensure you are doing this or you are doing that. We have to own it. We have to know that this is what is upon us. And if we don't do it, this is what will happen. You spoke about punishment for the mask, etc., not wearing masks, etc. There is no punishment. I mean, we made this point earlier, but we don't appear to have a clear punishment for it. What they will do is that maybe they will tell you don't enter the CBD. But apart from the CBD, there are other places people can go. You know, I don't know what they can do about that. But they are constrained a bit because there is no specific punishment for this. Let's say if you are found without the mask, maybe you will pay 100 cedis or they will detain you for a while. I don't know. But there is no clear punishment for it. So they are just using their common sense. And because we all understand the situation, you know, they are depending on that collaboration to enforce this. But it's proven not to be an effective way of doing things.
Okay, so yesterday the president also extended the ban on social gathering. Let's pick that video from the president on extending the ban on social gathering, and then we wrap up.
I've come into your homes to announce that the ban on public gatherings, as set out in Executive Instrument number 64, has been extended also to the end of the month, i.e. 31st May. So during this period, there will continue to be a ban on public gatherings such as the holding of conferences, workshops, parties, nightclubs, drinking spots, beaches, festivals, political rallies, religious activities and sporting events. All educational facilities, private and public, continue to remain closed. There's still a ban on funerals, other than private burials conducted with not more than 25 persons. It is noteworthy that the police are arresting and prosecuting persons, irrespective of their status in society, who flout these regulations. We cannot allow a few persons, for their narrow, selfish interests, to jeopardize the health, well-being, and safety of the larger population. If you fall foul of the law, you will face its full rigors.
Okay, so the president warning that if you flout these laws, social gathering, etc., you will be punished. But guys, Your final words on that, and then we wrap up. We have 2 minutes, 1 minute each.
It's time to step up. You see, the numbers as they are now indicate that we have to step it up. The numbers, I wish I could add, like I said, the only positive I will attribute to the numbers, the low mortality rates.
Yeah.
And long may they stay where they are.
Amen.
But apart from that, every indicator out there tells us that we have to educate more, and we have to enforce the rules more. That is all we need to do. We'll find our way back.
Okay. So
education as well, and education telling us to take seriously the protocols, social distancing, hand washing, sanitizing, more importantly, staying at home if you have nothing so critical to do in town, etc. The education should not end at the minister's press conference. We need to get people down there, get community champions. There are people who are very popular in the communities. If you come to Adabraka, for example, you go to the Sahara areas, there are people that, you know, things don't happen. Things don't happen if they are not there.
Yeah.
Look for those influencers, empower them, give them the information. Let them go out there to do the job. I don't know if someone like Bukum Banko in Bukum,
he says he's willing to do
has
it.
been contacted. You know, it's an opportunity. Let him understand what it is, give him what he needs, and let him go out there and do it. Guide him. Let him go out there to do it. There are a lot of people like that in communities. So if we just stay in Accra, or you know, it won't work. The education amongst a certain class of people is good, but there are people who believe that this thing is very far away from them, like Godfrey has said. We need to let them know that the thing is closer than you think. Like the factory hands have spoken about, going back to their community. A lot of them may live in Ashama, Newtown, etc. Look at how the places are. I think we need to get a bit more serious. And I'm happy with the NCCE thing. Let them get on the ground. I hope it's not one of those things we say and it takes 2 weeks
to implement.
I'm hoping that they've hit the ground running as we speak.
Okay, thank you very much, gentlemen. Godfrey Akoto Wafo and then Selam Adonu. My name is Vivian Kai Loco. Thank you so much for joining us. Goodbye.